Hi, I'm Gary Bebow, and this is my CEO connection for December. Today I have with me Wil Moore, an APRN, that is going to visit with me about, well, what's been happening in his field over the last several years. Actually, November the 13th was National Nurse Practitioners Week, and so we've been celebrating and recognizing that professions become so important to us in this area as providers for healthcare. Back in 1991, when I first started as a CEO of White River Health System, nurse practitioners were pretty uncommon. In fact, when I first started here, the nurse practitioner that I knew the best at that time was Dawn Stevie, who was the nurse practitioner in our Newark clinic. And over the years, the nurse practitioners have grown in stature, and it's really, frankly, I don't know how we could provide medical care to this whole region without nurse practitioners. They play such a vital role in the delivery of medical care, and we're really fortunate to have the group that we have, and Wil certainly being one of them. Wil started with us as a patient care tech in 2002, and over the years he's progressed and became an APRN in 2010. And so I've known Wil for all these years, and I can't tell you how proud I am of how he's progressed in his career and how meaningful he's been in our whole delivery system. So Wil, let's talk a little bit about APRNs and why you chose to get into that field, and tell us a little bit about it.
Well, like I said, I started in 2002 and started working on a med-surg floor as a patient care tech, and progressed my education to getting my associate's degree and becoming a registered nurse, and just felt the need to go on and continue my education. I did that by working in intensive care, getting some more experience, and getting my master's degree in nursing, becoming a nurse practitioner in 2010.
You know, I'm a little bit, sometimes there's some confusion as now. You work with a collaborating physician.
Absolutely.
So what independence do you have working separate from a physician, but then again, what oversight does a physician provide you in your field?
It's a necessary thing for sure. It depends on the venue of care, where it may be 100% physician review. You may be in there with the physician and working right there with them, and each chart may be viewed at the time of care. And it may vary out to the rural care setting, where maybe 10 to 20% of your charts are signed and viewed weekly. So it depends on the venue, but something that I don't think any nurse practitioner would want to go without is that collaborating physician and staying in touch with somebody.
It's kind of important probably for them to be relatively available then.
Absolutely.
In the case of a need at any one time. Now, when you got your APR, you worked in our hospitalist program for a period of time.
Correct.
Now, how long did you do that?
Almost 4 years. Started in 2010 and went to the cardiac clinic actually in 2014. So it was almost 4 years that I worked with them.
So now you work with Dr. Van Grau.
That's correct.
So what do you do over there during the day?
So the routine is primarily aimed at that transition of care from the patients in the hospital, getting them out to the outpatient setting, and ensuring that they have the things that they need and the timely follow-ups. We've got just a great group of individuals that work within the clinic. Very experienced radiology technician who does nuclear stress tests and echocardiograms. I do treadmill stress testing. I'll help walk the patients for Dr. Van Grau and also help with some of his follow-ups in the clinic.
So it's really helpful for him to be able to prioritize his time more like doing procedural type stuff. Absolutely. And allows you to do the direct patient care and follow-up work with them. Tell me about your prescriptive authority. What kind of drugs or what level of drugs can you order?
As far as the controlled substances, there's the Schedule 3 and down, so Schedule 3 through 5. One of the pain medicines just got moved to a Schedule 2. That was something that was commonly prescribed, but as you know, there's a lot of literature now and studies that show that some of the medicines are being abused, and it was something that was moved from a Schedule 3 to Schedule 2. So There are medicines that would require some continuing education to continue to prescribe, and in the cardiac field, that's something that I aim at each continuing education opportunity.
I bet you're really proud of the career, and I know you're going to do really great for us as time comes. And but I also know we got probably 20 or more, in excess of 20 nurse practitioners in this area, and I know several staff at White River Medical Center are working towards becoming nurse practitioners. What we can do with all those highly trained individuals?
Well, I think that's a good question, and that one of the great things about the middle care providers or physician extenders is that they remain really flexible. And this is different from the role that I had previously, but there's definitely some things that I can aim in on, and it may not be the direct cardiac care or the procedure, but it's the risk factors that contribute to the disease process. And as you know, most of these things are under the patient's control, and they're modifiable, whether it's smoking, high blood pressure, high cholesterol, and it's those things that we can aim in on and reduce their risk for recurrence.
You know, all the projections in the future is there's going to be a shortage of physicians, and so nurse practitioners can really play a major role in having physicians do those certain things that they really require their qualifications, and supplemented by the nurse practitioners that can really spread those physicians out to see more people. And I think in rural America that's really going to be important as we move forward, particularly in rural America. So I know that it's really been a pleasure having you with us, and I look forward to working with you more in the future.
I'm very thankful to be here. Thank you very much.
Thanks for coming. I have 2 employees of the month to recognize in the month of December. First one at Stone County Medical Center is Judy Rector. She's been in materials management for some 15 years, and she's always noted for looking for cost savings ideas and just a really good person to work with as in amongst her employees. And so I've known Judy for a long time, and she's well deserving of the Employee of the Month at Stone County Medical Center. Likewise, at White River Medical Center, John Lillard in our maintenance department has been recognized for his emphasis on environmental focus. And so John's been with us some 30 years. In fact, at the beginning of November, when we had our semi-annual awards ceremony, John received his 30-year pin at that time. And like his dad before him, John's a great employee of ours, and well deserving of this recognition. So if you see Judy and John over this next month or so, be sure to recognize them and congratulate them on receiving their Employee of the Month awards. The White River Medical Center family practice on Harrison Street, or Stacy Gibson's practice, is now been designated as our flu clinic. And so if you know of anybody who's suffering from maladies associated with the flu, be sure to recommend that they go see Dr. Gibson. National Hand Washing Awareness Week is December 2nd through the 8th. And National Influenza Vaccination Week is also that week of December 2nd to the 8th. And all employees by this time should have received their flu shot, which is now mandatory. We'll be having a Christmas gift distribution at White River Medical Center and at Stone County Medical Center, like we have in the past. And so be sure to look at for the calendar of events, times and dates in order to pick up your gift. The White River Health System Foundation has relocated across Harrison Street in the Hobby Lobby complex, actually on the west side of it. Then there's going to be an open house on December 12th from 3:30 to 5 o'clock p.m., at which time there will be a ribbon cutting by the Batesville Area Chamber of Commerce. So if you're available around 4 o'clock, come on over and participate in the ribbon cutting. Our calendar of events is available on Facebook, and so to be sure that you don't miss out on anything, be sure to either get on our website or on Facebook to identify what's happening in and around White River Health System during the month of December. This concludes my December CEO Connection. As in the past, any suggestions are welcome on improvement. So have a great holiday season.